During this video, we'll explain what's involved in a lumbar microdiscectomy, including how it's done and the potential risks and benefits. Here, you can see the lower part of the spine with the muscles, tissues, and other organs removed. In the normal spine, the bones or vertebra move because there is a jelly-like disc in between them. If it becomes worn down, the disc can herniate or slip out and pinch one or more nerves. This can cause pain in the legs, buttocks, and back. It can also affect the feeling and movement in your feet, legs, and genitals. You're watching this video because a surgeon has recommended you have a lumbar microdiscectomy, which means removing a slipped disc in your lower spine. After being put to sleep, you'll be placed face down on a special soft mattress. A small incision or cut is made in the skin. It's usually about an inch long, but may be longer or shorter depending on your personal requirements. The muscles and tissues are parted to reveal the bones of the spine. An X-ray is taken to make sure the correct spinal level is found. A small opening is made in the bone to reach the spinal sac and nerves. This part of the vertebra does not have any structural importance and does not usually need to be replaced or fixed afterwards. The surgeon then moves the sac containing the spinal nerves and spinal fluid to one side to reach the slipped disc. The slipped disc is then removed, freeing the pinched spinal nerves. The spinal nerves will then have a chance to recover. To finish, the surgeon will then close the skin with stitches or skin clips. The pain may improve immediately, but it might take weeks or even months for your symptoms to improve. Some symptoms of nerve damage may not get better at all. The purpose of this procedure is to reduce pain and improve mobility. We cannot guarantee that this will happen, but for most people that have this operation, there is some improvement. Out of every 100 patients, between 1 and 5 suffer from a minor or treatable complication from spinal surgery. These risks or complications may include wound infection. This is when bugs get into the wound and affect the healing. You may need antibiotics to treat it. Rarely, an operation is required if the antibiotics don't work. Bleeding or bruising, which usually resolves on its own over a few weeks. Rarely, if the bleeding does not stop on its own, you may need another operation to fix it. CSF or spinal fluid leak, which requires you to stay in hospital slightly longer to ensure it heals up. Sometimes, a further operation is required to fix this if it doesn't heal on its own. Some suffer an injury to a spinal nerve. If this happens, some patients suffer from increased leg, arm, or back pain. Some may have altered feelings on their skin or even a numb patch. This is often temporary, but it may, unfortunately, be permanent. Some people may form a scar around a spinal nerve. Over time, this can cause pain or discomfort, which may be similar or rarely worse than the pain before surgery. Even with surgery that goes according to plan, your symptoms may continue. In some cases, they may improve and then return again. The purpose of the surgery is to improve pain and mobility, but in some people it doesn't work or doesn't last. Most spinal operations require you to be face down to reach the spine. Parts of your body may feel pressure that they're not used to. This can cause soreness or even abnormal feelings in your body afterwards. This is usually temporary. Serious or life-changing complications occur in less than 1 or 2 in 1,000 patients. These may include one of the following: damage to spinal nerves, which can temporarily or even permanently affect your ability to walk, control your bladder, or control your bowels. It could even affect the feeling around your genitals and your sexual function. If this happens, you may require a period of rehabilitation. It may affect your ability to work and live your life fully. There's also a very rare risk of complete paralysis, which is nothing working from the waist down. If a major blood vessel is injured, this can cause injury to the legs. It may require immediate surgery to try and fix this. Most spinal operations require you to be face down to reach the spine. There may be pressure on your face and eyes. Rarely, this can cause injury to the eyes, which can affect your eyesight permanently. Some people cannot tolerate an anesthetic safely. They may have had a bad reaction to the drugs or develop complications from surgery. This may include blood clots in the legs and lungs, or stress on your heart, lungs, and kidneys. If you've had a bad reaction to an anesthetic in the past, please make sure to inform your medical team. If one of these uncommon risks turns into a complication, extra procedures may be required, such as a blood transfusion or further surgery. If any of these serious complications occur and they cannot be treated, there is an extremely small risk of not surviving the procedure at all. Thankfully, for most patients, there'll be no complications. You'll be encouraged to mobilize as soon after the procedure as you can. Most patients go home within a day or two. You'll be encouraged to do some walking and gentle exercise, which should build up over the next few weeks and months. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team. Thank you for listening. Please watch this again to ensure you have understood everything.